Let's understand the tracheostomy mask and T-piece in just 60 seconds. A tracheostomy mask, or T-piece, is a specialized oxygen delivery device used for patients who have a tracheostomy. It is specifically designed for those breathing spontaneously, but who still need supplemental oxygen support. Oxygen is delivered directly through the tracheostomy opening, completely bypassing the patient's nose and mouth. The T-piece, also known as a Briggs adapter, fits securely onto the tracheostomy tube to maintain a steady flow. This direct route ensures oxygen reaches the lungs efficiently, without upper airway resistance. These devices provide humidified oxygen, which is vital to prevent airway irritation and the drying of respiratory secretions. Nurses must ensure all connections are secure, maintain proper humidification levels, and monitor the patient's oxygen saturation closely. Follow for more nursing basics and respiratory care tips.